occasion of the CME cum workshop on postpartum hemorrhage, preventing the preventable, organized jointly by the Postgraduate Department of Obstetrics and Gynaecology, GMC Srinagar, and the Safe Motherhood Committee FOGSI. It's important to save the mothers who give birth to a new life. Mothers can be saved. I came to understand that PPH is also, the instance is quite high, and it can be preventable. That would be the theme, preventing the preventable. So in today's workshop, all the techniques that should be adopted, or the academic discussions to reduce the mortality rate, I think this would be an academic feast for all the delegates who are attending this CME cum workshop. So we all need to update our skills, and continuous medical education is the need of the hour. Once we interact with faculty and share our experience, and they share our experience, our skills will always be much better. And that should be what we should adopt from the administration side. Whatever support is needed, we are always there for each one of you. I wish the delegates a good academic feast for today, and thank you.
The topic of today's CME cum workshop as on postpartum hemorrhage, preventing the preventable, is relevant, apt, and very close to my heart, because all of us know that obstetric hemorrhage is still the leading cause of maternal mortality, along with infection and hypertension. Preventive measures as per Millennium Development Goals and SDG have led to decrease to some extent. Identifying of high-risk cases, active management of third stage of labor, judicious use of uterotonics and tranexamic acid have contributed in lowering deaths due to PPH. However, since life-threatening hemorrhage can also occur in absence of risk factors, and which we have many times seen in our labor room, and without any warning. Patient is totally normal, and next she is in PPH and shock. A clear plan should be in place in all facilities. Resuscitation skills and clear understanding of all medical and surgical treatments available and their application helps in favored outcome. Managing PPH needs not only a gynecologist but a teamwork with all members, with nurses, anesthetists, paramedics, knowing their part. As such, CMEs, workshops and PPH drills are useful and necessary tools in training the staff. In this context today, in the morning session, we are having deliberations on PPH and placenta accreta, which is again a killer and which is again increasing because of the cesarean section rate, increase in the cesarean section rate. So we'll have deliberations on this and get an overview. We are totally without any fanfare and anything having an academic session. We have invited paramedics and of course our residents. We want that they all should learn the drill and they should be knowing what they are going to do. I again welcome you all and hope that while learning you also enjoy. Thank you.
So on PPH, I would say that definitely it is a preventable thing and we can prevent it provided we work with a team, we work with a vision that we have to be very active, we have to diagnose the thing at the right time and start action like this. Within fraction of seconds, your mind should go like this, that ye karna, ye karna, ye karna, ye karna, isko ye karna, isko ye karna, isko ye karna. The team has to be very perfect, and if we go like that, I think the death can be definitely prevented. And I was really, awestruck to see that this is a 700 bedded only maternity center, or I mean the gynecology and obstetrics center. And I always thought that this is a hospital with all the specialities. So you see the people here who are working, they must be so experienced that वो कहीं भी जाएंगे, कहीं भी खड़ा कर दोगे उन्हें, तो वो काम ऐसे करेंगे, because that is what is there, they have been doing the whole time. और बिल्कुल spinal level पे आपको जब आपने 2-4 drills कर ली PPH की, the things will go to spinal level. आपको बिल्कुल सोचना नहीं पड़ेगा, बिल्कुल कुछ करना नहीं पड़ेगा. स्टार्टिंग में for 3 to I think 3 or 4 patients के management में you may fumble at a point, but after that you will never.
The aim is that this needs to percolate into the young brains. I'm sure all of us here as consultants know how to manage a PPH, whether it's, yes, new techniques will keep on coming and education is a continuous process. But the point is that are we able to, is our teaching that good that our postgraduate who's in the second stage is able to pick it up at the right time, report it at the right time, and is our team that much aware that the whole team comes into action in a second time. So PPH is not something which my second year or first year alone in the second stage is going to manage. It is my team which is going to manage, which includes my sister on duty, which includes my staff boy who is there on duty, which means that I am my labor room is fully equipped with the drugs that I need to use at the right time, and it needs a system. Is my labor ward boy there? If I have to shift this patient to theatre, is he available at the right time to shift the patient? Am I losing another golden half an hour in shifting the patient up when I have to do an intervention on the patient? So that is the aim which we have to, most of the times, we are able to save the life. It's not only saving the life, it is also decreasing the mortality. So it's not all that we do is that at the end of the day, what we do is when we have such a morbid condition, do a hysterectomy. What I see from this program is that how many hysterectomies are we going to prevent in these young patients? So with this message, I thank you all for gathering together here and coming forwards for a continuous process of education, including my members from the paramedical staff, who are an equally important wing of management of all patients, not only PPH, whatever it is, that we are a team and we need to learn to work as a team. Thank you very much.
As we all know, postpartum hemorrhage is one of the important topics in obstetrics. Many young patients are dying of this postpartum hemorrhage. Our Department of Gynae and Obstetrics, they are very proactive in conducting such type of education programs on time. Although they have very busy schedule of duties, they are overburdened with patient load. In spite of that, they are holding these CMEs on time-to-time basis. It is very appreciable and it is important for young budding resident doctors and clinicians to cut across the barriers, and it will have a deep impact on lives in the long run.
Always the only healthcare worker who is with the mother who can actually take care of her at that time. So it is at this moment, it is the wits, the intelligence and the training level of that healthcare worker, be it an MBBS doctor, a nurse, depending upon whether this mother is delivering in a PHC, at home or in a tertiary care hospital, who is a healthcare provider at that point of time. Their intelligence and their training is going to save her life if she develops the dreaded complication of PPH. Given the magnitude of the problem and the impact training can have in helping these patients, we came up with this program so that we can unlearn old habits and we can learn new things.